Hi everyone, I welcome you all to my YouTube channel. I am Dr. Siddharth Katkade, a consultant spine surgeon practicing at Bombay Spine Clinic, Baikala, Mumbai. As we have previously discussed about the structure, the anatomy of the spine, the function and the mechanics of the spine, today we are going to discuss about the entire spinal pathologies which can affect a different age group in the lifetime. So let's begin. The spinal problems in the children can start right from the birth, and these are termed as congenital spinal problems. The congenital problems can affect the spinal cord, which is a neurological structure, or it can affect the bony covering, those are the vertebrae. The neurological structure which get affected are duplication of the spinal cord, which is termed as diamyelia, split in the spinal cord, which is termed as diastometamyelia. It can be a tethered cord syndrome or a spina bifida. It also affects the covering of the spinal cord, which are meninges. It can be in the form of meningomyelocele or just meningocele. The congenital problems involving the bony structure of the spine can be a hemivertebra. A hemivertebra is malformed vertebra where the vertebra is not completely developed. It is in a triangular shape or a rectangular shape, because of which, as the baby grows, there is abnormal curvature in the spine and it leads to congenital scoliosis. The scoliosis per se in the children can be congenital scoliosis due to hemivertebra. It can be adolescent idiopathic scoliosis, which the reason remains unknown and it contributes to a significant number of scoliosis cases. And thirdly, it can be due to neuromuscular scoliosis, where the support structures, the supporting muscles of the spine are weak, and that's why the spine starts collapsing. The other common problems can be due to sports injury. This can range from sprain to ligament injury to a disc injury leading to annular tear. Also, in such cases, stress fracture in the spine in the vertebra is common. Also, in some cases where the children's having medical issues for prolonged period and their immunity is weakened, such patients are prone to get infections in the spine in the form of discitis or spondylodiscitis. One of the commonest form of infection in such cases is tuberculosis. Talking about the spinal problems in the adult group, these are mainly mechanical and posture related problems. It can be mechanical low back pain, back sprain, or neck sprain. It can be postural kyphosis, or simply a hunchback. It can be a Schurman's kyphosis, where there is end plate degeneration and excessive deformity in the back. Secondly, degenerative problem, that is wear and tear related problems, are common in this age group, and these are spondylosis, spondylolisthesis, disc herniation, slip disc, etc. Thirdly, an autoimmune condition, which is inflammatory ankylosing spondylitis. This is the unique problem which is restricted to the spine and the SI joint. This condition has a tendency to sclerose the spinal ligaments, making the spine more stiff and eventually giving a deformity in the spine. Rarely in this age group, spinal tumors are also seen. This can be in the form of spinal cord tumors or vertebral body tumors or tumors from the other primary source, which are metastasis. And finally, the spinal problems affecting the geriatric population. These are mainly metabolic issues, that is osteoporosis. Osteoporosis makes the bone weak, which can easily get fractured even after a trivial trauma or a fall. Because of this, the posture of the patient starts drooping. The second most commonest problem is the posture related problem, where the older people attain a drooping posture and a flatter lower back, making them difficult to walk straight and erect. The third most common problem is a degenerative problem. This problem begins in the adulthood, in the lumbar spine and the cervical spine. and it accelerates in the geriatric population. In the cervical spine, this problem presents with cervical spondylotic myelopathy, where patient finds clumsiness in their hands, weak grip, difficulty in balancing. They use walker or stick to walk, and sometimes it also affects their urine and motion control. In the lumbar spine, this problem can present in the form of spondylolisthesis, where the one vertebra slips over the other, lumbar canal stenosis, where the main spinal nerve gets compressed and gives symptoms in the legs, where the patient is not able to walk beyond a certain limit. Thirdly, some malignancy like multiple myeloma or metastasis are commoner in geriatric population. So, it is important to understand entire spectrum of the spinal problems so you can present to us in early stage and we can treat well. So if you find this video helpful, do share with your colleagues and see you in the next video.